Thank you very much, Bonsai
All
Betty.
right.
It is 6:54 on this Monday morning, and every Monday we get a chance to ask a specialist. We welcome in Dr. Scott Moon, who is going to tell us a little bit more about, and I know you touched on this first time around with Trini. Touch a little bit again on what radiation oncology is and exactly what that entails.
So it's a highly specialized technical subspecialty in medicine treating cancer patients with high energy photons and electrons, made by these very sophisticated machines that need loving care to keep going and treating accurately and safely.
Would you say this is when we talk about your team and when we talk about the equipment, is this the cutting edge sort of medical technology? I mean, it sounds like.
Most definitely, and it's always evolving and advancing. So right now, again, like I said, we have the most advanced machine, the tomotherapy machine, which has the ability to paint the dose around the target you're trying to hit and carve out critical structures you're trying to avoid. To get that done, though, like I said, you really need a high-quality team, and like we have at the Queens Medical Center.
How many different centers are there? Obviously, Queens is one here. How many are we talking about around the country?
So around the country, there's over 2,200 facilities.
Okay.
And accredited facilities, though, like I was telling Trini, is less than 15% probably have the accreditation.
What accreditations do you guys have?
So it's the American College of Radiology, American Society of Therapeutic Radiation Oncology combined. They do an accreditation where they send in their physicists and physicians check out how are you following all the policies and procedures to make sure patients are being treated safely and effectively. And they give you a stamp of approval once that's done. And we did just get ours in March, renewed.
I know you guys must be very proud. And as you said, how rewarding is it to work in this field? What's it like for you?
Oh, it's tremendous. You get to see patients who are in the depths of despair come into your door, and you have the opportunity to offer them large amounts of hope for cure many times. And even if you can't cure them, you can a lot of times take away pain, make their quality of life much better than when they stepped into the door. So it's a hugely rewarding field to be in.
Dr. Scott Moon, thank you so much for joining us from the Queens Medical Center. We're talking about radiation oncology. Thank you so much on this Monday morning.
Thank you very much.
All right, still to come on Wake Up Today, we've got top headlines and much more coming up on Wake Up Today, including a Las Vegas...